Well, welcome back. COVID-19 has been getting all the attention, but we know what's still out there, the common cold. We all know how miserable a cold can be, but there are strategies that'll help you avoid catching that cold. We're joined this morning by Dr. Denise Kerut, a local pediatrician. Good morning. How are you?
Good morning. I'm great. How are you?
Good, thanks. So, I mean, it's interesting to kind of talk about the common cold, when we're in the midst of a pandemic. It seems like it's kind of gone by the wayside, but you know that the cold is still out there and people are still getting infected with it, right?
Yes, they are. And the best thing you can do to prevent getting sick with the cold is wearing your mask. So keep wearing them when you're in groups of close to other people. It's a good idea to wear it. It'll help prevent the common cold, just like it'll help prevent COVID. And also washing your hands is also a great idea with soap and water.
Right, washing your hands, the 20-second soap, warm water. Been talking about that since really even before COVID. What are some of the differences that people might see between the common cold and COVID?
So typically with the common cold, you get a runny nose, nasal congestion, a slight cough, and sometimes a little sore throat. With the COVID, a lot of times we're seeing fever as well. And so if you have fever, you really need to suspect COVID over a common cold. And a lot of people with COVID get really significant nasal congestion. Some of them get a sore throat and some don't get any sore throat. So if you're unsure, and it's really difficult even for a medical doctor to tell the difference sometimes, it's best to get tested and also to isolate yourself from other people so you're not spreading it around to your friends and family.
Right, that's kind of the idea that, assume that you have it if you have symptoms, but at the same time, hey, if you're sick, regardless if it's COVID or the common cold, you probably shouldn't be going around other people anyway, right?
Exactly. That is really good advice. It's best to stay home when you're sick. If you've got a runny nose, a cough, a sore throat, nasal congestion, fever, any of those symptoms, it's really best to stay home because they're most likely due to a virus, whether it's the common cold, rhinovirus, or the COVID virus. And so all of those can be spread by coughing and sneezing, shaking hands, touching doorknobs that are infected. So it's best to stay home when you're sick and prevent the spread of any illness.
All right, so we always talk about, and we have for several years, that there is no cure for the common cold. What can you do if you get it? Obviously, if you have COVID, there's some certain treatments that we've heard about, but with the common cold, it's just fluids and rest.
Yes, and if you have a sore throat or a cough, honey has definitely been shown in our medical studies to help with that. It coats the back of the mouth and makes it feel better. Drinking warm liquids like warm water with fresh lemon and honey, you get the honey to coat your throat, and the lemon gives you vitamin C, which has also been shown to boost your immune system and help you fight infections too. Also, humid air helps. So here in New Orleans, you can just open your windows or step outside. Or if you're using your heater, especially, make sure you're using a humidifier, especially if you have little ones, because their nasal passages are so small and tend to dry up quickly, and the humid air will really help. If you don't have a humidifier, you can just steam up the bathroom with a hot shower and get some good humid air in your apartment or your home that way too.
Some really good tips there. Thank you so much for joining us this morning. We certainly appreciate it.
Thank you for having me. I hope everybody stays well. And we're here for you guys if you need us.
Absolutely. Thank you so much.